We're glad to have you with us. I'm David DiBiase, an Associate State Director at AARP Virginia, and we are so glad to have you here on this important discussion about COVID-19 vaccines. To help everyone have a informative session, a wonderful session, we have muted participants, but of course we still want to hear from you. So if you have a question, you can just type it into the box labeled chat. So we have 3 panelists with us this morning, and you can ask any one of our panelists a question at any time during this Zoom, and that will be by typing into the chat box. So to begin, let me tell you our distinguished guests. We have Angie Phelan, a director at Senior Connections. Senior Connections is the area agency on aging serving Greater Richmond. And Yvette Jones, who works for the city of Richmond as a program manager for the city's Office of Aging and Disability Services. And we did have an invitation to Dr. Melissa Veray, the Deputy Director of the Henrico and Richmond Health Departments. And here she is. I believe she has joined us. Great. So we have 3 panelists and we have all you wonderful participants, and you'll be able to ask questions of the panelists by going to the chat box. But let's begin with AARP asking you a question to hear from you. And it's about how likely you are to get a COVID-19 vaccine. So the question should appear on your screen. How likely are you to get vaccinated for COVID-19? And as you can see, you have 5 answers. You can click the bubble that best reflects your answer. I already got it. I'll get it as soon as possible. Not yet, undecided, or I do not plan to get the vaccine. And we'll share the results of this in just a moment. So we'll give a few more moments for you all to read the question, click an answer, and then hit submit. And we'll find out a little bit about you as our audience. So I am not in control of the poll. But hopefully someone behind the scenes is. Okay, so it has appeared on my screen. If you're calling in, you won't see this, so I'll give you the results. 9% of you have said that you already got it, which is a little below the national average, and I believe Virginia is at 12.4% of our population has been vaccinated, so you're a little below that. But 86% of you, which is no surprise, said that you will get it as soon as possible. And of course, we're going to have information for you, what to do if you're looking to get a vaccine. No one said, I'm not planning to get it, I'm waiting first for others. And just 2% said, I'm undecided, I want to learn more about the vaccine, and I do not plan to get vaccinated. So we have 86% of you on the phone saying you'll get it as soon as possible, and let's get to that information as soon as possible. That means that I'm going to turn it over to Dr. Veray, a physician and the Deputy Director of the Health Districts overseeing Richmond and Henrico. Dr. Veray, I know you have a lot of information for us. I'll turn it over to you.
Thank you for having me. And thank you all for being here today. I apologize for my voice being a little bit hoarse. And if you do mind if I share my screen? Go ahead and do
yes,
that.
please.
All right. What I'm going to do here is, and I'm going to take my video off so that it doesn't, my internet doesn't go down. But y'all can hear me still, hopefully. Going to talk to you all about, just give you a little bit of information about what you need to know about this the COVID-19 vaccine that we have out, vaccines that we have out right now. So it's worth knowing that early on in the pandemic, right, actually we're talking about, more than a year ago now, we had a lot of pharmaceutical companies realized that there was going to be a need for a vaccine, and there was a lot of investment, both using traditional and newer vaccine types, looking at how can we get a vaccine developed that could protect against this new pandemic. So looking worldwide, not just in the US, there were hundreds of vaccine candidates in the pipeline for development. And around the world, certain vaccines have already been approved and fully authorized for use. In the US, though, what we're looking at, there it is. In the US, we are right now looking at 2 vaccines that have achieved emergency use authorization here in the US. And the first is one out of Pfizer, and the second was a Moderna. There is a third vaccine candidate out of Johnson & Johnson that is set to be evaluated by FDA and their advisory group this in about a week, actually on 8 days, on the 26th of February. So there may be a third addition to this panel of vaccines very shortly, but that is TBA. And it's worth talking about. So these 2 vaccines, they actually work in the same way. Both the, sorry about that. All of our vaccines, whether they be polio, influenza, measles, mumps, rubella, all of them work in different ways. And they use different aspects of the virus or virus infection to be able to teach your body how to defend against this infection. These 2, both the Pfizer and the Moderna vaccine, they work in the same way. What they do is they take a bit of genetic sequence that programs for the actual spike on the outside of the coronavirus. And just that, it doesn't do anything but that little spike on the outside. And they take that genetic code and they inject that as part of the virus into your body. And your body cells use this genetic code to actually manufacture a little bit of this spike protein. It does not work as the virus. It does not work by itself. It's just that little spike protein. But using that protein, your cells then it teaches your body and your body cells how to defend itself against this foreign protein. And then shortly thereafter, your body gets rid of the genetic sequence. It doesn't, it doesn't stay around for very long. It also gets rid of that little protein, but it holds on to the ability, that learned ability to defend against that spike protein. So in the event that it shows up on the outside of the actual coronavirus protein, on the outside of the actual coronavirus virus, your body already knows how to use its cells and its antibodies to protect itself against this virus, so that you don't actually get sick. And what's important to know is that you cannot get COVID-19 from these 2 vaccines. It's really just a little bit of genetic sequence for one of the proteins on it. In no way, shape, or form do they contain live or inactivated virus. And so there's no risk of it being infected with COVID-19 from receiving this vaccine. These 2 vaccines, Moderna and Pfizer, again, I'm not going to talk about Johnson & Johnson because it hasn't gotten authorization yet, but these 2 vaccines, there's 2 different types. There is no difference in recommendation between the 2 in terms of what you might get. Whatever is available is what individuals will get. Basically, there's no difference between the 2 for the vast majority of individuals. But the 2 vaccines, one is at, making sure I'm not muted here. Good. One is at 70 degrees. One is kept at ultra cold, it's -70, and that's the one that requires the special freezers. And then one is kept at more routine freezer temperature at -20. The thing for you all to know is that besides the fact that they're both the same type of vaccine and they have different storage conditions, one is a 21-day series and one is a 28-day series. It's really important that regardless of which one you get, that you start and end with the same vaccine. So if you get a Pfizer vaccine, 21 days later, you get a second Pfizer vaccine. If you get a Moderna vaccine, 28 days later, you get a second Moderna vaccine. It's very important because we don't, to get the maximum effectiveness of these vaccines, that you get both doses of the vaccine at the appropriate interval. I know there have been some questions around these variants that are circulating in the B117 out of Britain and the 135 out of South Africa and the one in Brazil about effectiveness or efficacy of the vaccine against those two. And right now, there is some evidence that it should be effective against the UK variant or the B117 variant. They are still evaluating against the P1 in Brazil and the B135 in South Africa, but it is not felt to be a significant risk. And they are already evaluating whether or not there would need to be amendments or boosters to the vaccines that are given just in case. But either way, it is effective against the one that's in the US right now. It's thought to be effective against the one that's being that's in the UK right now, and there are ongoing evaluations regarding what it means for the other variants that are arising. The best way to prevent variants from arising is to vaccinate so that we don't give the virus the opportunity to mutate and become a variant. So the more people we have vaccinated in general with the current virus that we have, or against the current virus that we have, the less chance we have of having more variants that might not work as well or that might not be as susceptible to our vaccine. A lot of folks ask questions around why, usually it takes years to get to a vaccine. How did we get here so quickly? Well, the truth is that the scientists here did not start from square one. You might remember SARS-CoV from in Hong Kong in 2000. And then you might remember MERS, Middle East Respiratory Syndrome, from about 5-10 years ago out of the Middle East. They started vaccine platform development back then, but because it never became widespread, they never actually had to finish it. But the scientists for COVID-19 were able to use that to kind of jumpstart, and some other platforms as well, and traditional platforms as well, to jumpstart the work that they were doing. And in addition to that, several groups, about 6 vaccine candidates, even before they were fully in development, benefited from a lot of funding from the federal government as part of Operation Warp Speed to help them accelerate their process. And I'll talk a little bit about what that means in terms of they didn't get to shortcut any of the safety or the research part of it. They were able to invest in manufacturing and being able to do mass production earlier on in the process, which helped them get more vaccine out quicker. What this means when I talk about vaccine development, for all vaccines, for all vaccines in the US, all vaccines in the US, excuse me, there is a process through which all vaccines have to go through development. Before you try it in humans, you have to do some animal studies to evaluate, will this platform work in mammals? What does it look like? What does it do? And once you have enough information, then you're able to go into phase 1 clinical trial. And that's usually 20 to 100 folks. And it's a small group to look at dosage, what's the right dosage? Is it a safe vaccine? And does it generate an immune response? If it looks promising, these move into phase 2, which is usually hundreds of folks. And usually with, different health conditions, older and younger folks, men and women both, to look further at safety. Is it safe? Is it safe for this dosage? Does it generate an immune response? But primarily to look at safety. And then phase 3 is the largest of those. And these are tens of thousands of individuals looking at how well the vaccine works, its efficacy to prevent infection, which is what we want to avoid. And then it continues to look at safety. For our sake, in our case of Moderna, it was 30,000 individuals in phase 3, and in Pfizer, it was 44,000. So tens of thousands of individuals had both doses and then were evaluated for a period of time after to look at whether or not it prevented infection or symptomatic infection, and whether or not there were any safety issues. After phase 3, then researchers can apply for emergency use authorization in the FDA. If there is a formal review of safety and efficacy by the FDA and their advisory panels, and if they're found satisfactory, at that point, an EUA is granted, an emergency use authorization, and then they're able to bring it to the CDC's advisory committee and and immunization practices to make recommendations on how it's to be used. This is where we're at. That's what they've done with Moderna and Pfizer. so that CDC has gone out and made recommendations about how to use it, and they've been able to bring it out to the public. And in trials, and in the studies thus far, or in the studies for Moderna and Pfizer, there was an efficacy of up to 95%. This was not expected. We didn't expect it to be this good. The flu vaccine on a year-round basis usually runs around 40 to 60% of efficacy. This is a lot better than that. We were stunned in the scientific community when it was found to be this good. What this means is for Moderna, out of 100, so out of the 30,000 individuals who were vaccinated, who were in the Moderna trial, there were 196 cases of COVID-19. Of those 196, 185 were in those who didn't actually receive the vaccine but received a placebo dose. In Pfizer, what they found was that out of their 44,000, there were 170 cases of COVID-19, and 162 of those were in those who had received a placebo or not actually a vaccine dose. So we found a very high, efficacy in clinical trials, which we hope will translate into a very high effectiveness out in the public. But the next question you might ask is, so is it safe? Something that's important to know is that, again, going back to all clinical trials for vaccine, those phase 1, 2, and 3 trials that I mentioned, all of the clinical trials in the US have what's called those are geared at looking primarily at safety and then at efficacy. So their primary goal is this safe? Are there any adverse effects? Are there any concerns that we need to know about before bringing this vaccine out? And additionally, for all US trials, there's what's called the Independent Data Safety Monitoring Board that's assigned to each trial. These are scientists who aren't paid by the pharmaceutical company. Their only job is to look at the data from the vaccine trials and be empowered to say, you have to stop if there are any, they're empowered to stop the trial completely if there are any major safety concerns. And it's important to note that for both Pfizer and Moderna, both data safety monitoring boards found no safety issues or no major safety issues of concern with either vaccine. After the emergency use authorization, there are there's multiple ways that we monitor, that we in public health and at CDC and FDA monitor for any events after we've rolled out a vaccine. The first is a vaccine adverse event reporting system, or VAERS. This has been around for a long time out of CDC and FDA. And for any provider who gives vaccine, they are tasked with, if there's an adverse event after vaccine, they report to VAERS so that CDC and FDA are alerted to and are able to monitor for any adverse events if there's a difference between what happened in the 75,000 in the Pfizer and Moderna trials and in the millions as we bring it out in the US. vSafe is a CDC program that you enroll in after you receive a vaccine that pings you every day saying, how are you feeling, for the 14 or so days after you receive your vaccine, to elicit or to ask you, how are you feeling? What symptoms are you having? Are you having any symptoms after your vaccination? To help us to understand and to be able to identify whether or not there's anything of concern earlier than not. So as I mentioned, neither vaccine, neither Pfizer or Moderna had any serious safety concerns. It's important to know that Pfizer has only been studied in children down to 16, as old as 16 and up, and neither vaccine has been studied in pregnant women. That being said, both the American College of Obstetrics and Gynecology and CDC have come out with, it's a risk that, there is nothing in how the vaccine is made, or what we know from, the animal models, or what we've seen in women who've gotten inadvertently pregnant in the clinical trials, leads us to concern for women who get pregnant. So if you are a woman, if you know a woman who is pregnant and is considering vaccination, if she's indicated because she is a healthcare worker or otherwise at risk, she should seriously consider getting vaccinated. There are contraindications, or meaning things that prevent you from getting this vaccine. If you have If you've gotten your first dose and you had a severe allergic reaction, that will prevent you from getting a second dose. If you've had an allergic reaction to injected polysorbate or polyethylene glycol, these are two what they call excipients, or they're called they stabilize different kinds of medications. They're in a lot of different medications, and so it's a pretty uncommon allergic reaction to date. So it's not, if this is something you're allergic to, you will have been specially tested for it, because it requires a special test to be to determine that you have an allergy to polysorbate. If you have, for whatever reason, if you have concerns around it, you should absolutely talk to your provider. If you have had other injected materials, we may, like you've had other injected medications and you've had allergic reactions to those, we may watch you for longer after your vaccination. It does not prevent you from getting vaccine. If you're allergic to eggs, if you're allergic to other foods you've eaten, to nuts, these are not contraindications. These are not precautions. These do not prevent you from getting the vaccine. Most individuals who are over 55 have fewer side effects than those who are under 55. But in general, we have seen a fair number of individuals have had some soreness around the injection site. That's to be expected. Some individuals have fevers or malaise or feeling fatigue, some joint or muscle pain. Generally, this starts the day within 24 to 48 hours of your vaccination, and it lasts for about 1 to 2 days, no more than that. And again, it is much less common in those who are over 55. And it is, and again, we do see this more often after the second than the first dose, but it can happen after the first dose. So who gets the vaccine first? Oh, I'm running out of time. As I mentioned, excuse me. As I mentioned, the advisory committee, CDC has the advisory committee on immunization practices. These are the same folks who make recommendations about the flu vaccine every year. They make vaccinations about measles, mumps, rubella. These are folks whose job it is to evaluate vaccines every day, every year, to make recommendations about how we should be using vaccines in the US. For COVID-19 vaccine, their goals were, they declared goals to decrease death and serious disease as much as possible, to preserve functioning of society, to reduce the extra burden the disease is having on people already facing disparities, and increase the chance for everyone to enjoy health and well-being. Of COVID-19 vaccines. Phase 1, healthcare personnel, meaning your people who are taking care of individuals who have COVID-19, or in individuals in hospitals, and then individuals in long-term care facilities, because they tend to be over 65, they tend to have other medical conditions, they are at risk for outbreaks, folks that we hit first. And then 1B is a much larger group. And for Virginia, that's everyone over 65. That's our frontline, our front-facing essential workers, meaning our police force, our teachers. And it's also, in Virginia, it's individuals 16 to 64 with conditions that put them at increased risk for severe infection from COVID-19, and then individual living in correctional facilities or congregate homeless shelters. Phase 1C will be our other essential workers who aren't front-facing, and then phase 2 is anyone who wasn't already, is our general population and everyone else who hasn't otherwise been vaccinated. I think it's important to note that right now, to date, Virginia as a state has only received 1.7 million vaccines, which is a lot of vaccine, and there's more coming every week. But it's not quite enough for us to get everyone vaccinated who we know is eligible as part of 1B to get vaccinated. And in Richmond and Henrico, we've either administered or distributed somewhere around 34,000 doses of the 36,000 we've received, and we're getting more out. Well, we're not vaccinating today because of the snow and ice, but we had planned to put more into arms today, and we are planning on putting more in arms tomorrow. Right now, because of the vaccine supply and the fact that we only get a little bit of vaccine per week, we are not vaccinating all of 1B. We are vaccinating all of those who are over 65. So I'm imagining that's a lot of the folks who are here in this conversation, here in this webinar right now. And we are also vaccinating the first 3 of our frontline essential worker categories, so police and firefighters, and our childcare and K-12 teachers. We are not yet vaccinating the rest of our frontline essential workers yet, and we are not yet vaccinating those who are 16 to 64 with medical conditions that put them at risk, because we just don't have enough vaccine yet. We are anticipating getting more vaccine in coming weeks, and we do anticipate opening up vaccine to those larger groups of individuals in coming weeks, but it just isn't there yet. But for those of us on this call, I would guess the majority, if not all of you, are in that 65 plus category. And so you should, if you have not already, go to vaccinate.virginia.gov and set up and apply there on the pre-registration form, because that's how we know to contact you for vaccination. And I'll talk a little bit more about what that looks like. If you've already registered on our local vaccine site, vax.rchd.com, you are already in our system and you do not need to go to this new state system. But if you haven't already and you're 65 or older, get on this form, fill out this form. And that's how we know you're there. And that's how we know how to contact you, so that you'll be able so we can contact you so that we can schedule you for vaccine. We are vaccinating through a number of different modalities. So a lot of, and we're going to focus right now on this top part right here. So our 65 plusers and our health, and if we have any leftover healthcare workers.
Dr. Bray, can I
yes.
interrupt you for a moment?
Sorry, I'm running over, I know. Go ahead.
Yeah, I'm thinking this is going to confuse people. We have some great questions for you that might be more to the point of what people want to know.
Oh, sure. Let's do that.
Yeah, let's switch to that. We might, hopefully people can stay with us, because we have 2 other panelists.
Yes, sorry about that.
And we wanted to do a 10-minute Q&A with you. You're still sharing your screen.
Let me stop.
So that might get us back to normal. I think based on what's coming through the chat box and the question and Q&A box, people want to know, how do they get a vaccine if they're in Henrico or Virginia? Yeah. I know the state just put up a new system. So maybe if you could say, how to reach the new system, what happens if you're already in the new system, and maybe what the algorithms are for how the state prioritizes you. And I think you can also assume that people on the call are over the age of 50. ARP is a 50 plus organization. So certainly we're prioritizing 65, but your audience is 50 plus.
It's 50 plus, that's good. Okay. So right now, for Richmond and Henrico, where if you've already been in the system, if you've already gotten a vax to rchd.com, you are on our list already. If you are not, again, vaccinate.virginia.gov is how you get onto what's called a pre-registration list. And by entering your age, entering your race, and your contact information, that's the most important part. That's how you end up on one of our what we call wait lists. And when we in Richmond and Henrico get those wait lists, we prioritize by age, and we prioritize. So in other words, we know based on what we've seen from the pandemic that the older you are, the more your risk of severe infection and severe outcomes from COVID-19. So we look at age, and then we also know from the data that we've seen that persons of color, so individuals of Black or Latinx at this race or ethnicity, have more severe outcomes, higher rates of fatality, and higher rates of hospitalization. So we're also looking at age, we're looking at race, and then we're looking at timestamp right now. So if for example, if you were, we are, so basically the older you are, and if you are of a demographic that is proportionally affected, meaning you're a Black or Latinx race or ethnicity, or and the earlier you put in, the sooner that we're going to get in the lists. Now we have tens of thousands of individuals on these wait lists, and because we're only able to vaccinate a couple thousand, maybe 6,000 a week because of the vaccine supply, we're getting through them as fast as we can. And so what ends up happening is that we may either reach out through your email, or we may reach out by phone, depending on what modality we're using to schedule different vaccine events. So if you are, it's better if you can provide both of those pieces of information. And then it does require that you be patient with us, because because there are so many individuals on our wait list, it's just taking a bit of time to get through where we're to all of the individuals who are eligible, who are 65 up. Now, the individuals who are 50 to 64, we are not yet open to vaccinating. We're in Henrico and Richmond. We have not yet opened up vaccination to those individuals, because we just don't have enough vaccine yet for our 65 plusers. We hope to be there in March. And once we do that, individuals who are 50 to 64 who have medical conditions like diabetes, severe asthma, cancer, other conditions that put them at increased risk for severe infection will then be eligible. And you can go ahead and register and put your name on the wait list now. If you're 50 to 64, go ahead and go to the site and put yourself in now, but just know that you will not be called down yet, because we aren't vaccinating in that group yet.
Okay, so let's give people that number. It's 877-829-4682. And of course, we will put that in the chat box. It will also come up in the program in the last slide that we show. And we will send you a follow-up email with that phone number. It's the phone number to Vaccinate Virginia. You can talk to someone at Vaccinate Virginia when you call that number. And that number is pretty new. It's like within the last 24 hours that it has been made public. You can also go online, vaccinate.virginia.gov, all spelled out. It's the same system, and it's taking over the Henrico City of Richmond system.
That's correct.
So
That's correct.
we're now cascading down from the state system.
That's correct.
And there are many questions in the chat that I think that we can get to people after this program's over. We will have all the questions on hand, because this is being recorded, and we'll get those questions answered in writing. But let's move to our next speaker, which is Angie Phelan from Senior Connections. Angie's one of the senior directors of that program, our area agency on aging. And she's going to tell us a little bit about what Senior Connections is doing to help older adults and family caregivers get connected to the vaccine.
All right, thank you. And I wanted just to say that we're an area agency on aging, and we cover Richmond, Henrico, Hanover, Chesterfield, Goochland, Powhatan, New Kent, and Charles City. We serve as a resource for older adults and caregivers, and we connect people to resources and services. So being that said, that's a great opportunity for us to get word out to those individuals about the vaccine. And with our dedication to older adults so that they can remain independent and have a good quality of life as they age, we've got a lot of services that we offer and resource connecting that we do that enables us to share via the phone and information about the vaccine. One of the ways when we first, COVID first hit and we had to turn around and respond quickly, just as many others did in our area, was we wanted to make sure we were continuing to serve our clients as safely as we could. So for example, we have about 470 individuals that participate in congregate meal sites, which we call friendship cafes. Since they couldn't continue that, we were able to set up meal delivery program for them and remain engaged, which again gives us the opportunity to communicate with them about the vaccine and the opportunity to pre-register for that. We have also our Ride Connection program, and you can go to the next slide on that. It's the next one after that. Yeah, that one identifies the various groups that we work with as far as connecting people to transportation. And when we first were under COVID and things were very limited, we still worked with our providers to provide transportation to essential medical appointments. And now we are back up and running and helping people get to those medical appointments and various other needs they may have. One of the things that's really important as we get people registered for the vaccine and they have appointments scheduled, if you need a ride, you need to let our Ride Connection office know as soon as possible and connect with them. They can discuss with you opportunities for ways to get transportation in your area. And then if you need us to coordinate that transportation for you, we're going to need as much notice as we can in order to make that happen for you. The slide you saw before was just about, I wanted to mention our Benefits Enrollment Center. As a lot of clients, there's a lot of benefit programs and enroll in, and I wanted to mention that and the opportunity there to reach out to our benefits enrollment specialists, who again are also available to help individuals know more about pre-registering for the vaccine. It's just, we also are setting up a center in our building where we will be calling our clients and offering them the information and assisting them with pre-registering if they need. Always call our main number and you can get directed from there, and that is. Thank you.
Thank you, Angie. Really important information. Thank you for all the work that you're doing and your community partners are doing. And please give a big thank you to Thelma Watson, who wasn't able to be with us today.
We'll do.
We'll turn it over to Yvette next, and then we'll have a few minutes today for a Q&A that all three of our panelists could speak to. But as you see, Yvette's from the City of Richmond Office of Aging and Disability Services. Take it away, Yvette.
Good morning and thank you. Thanks to AARP for hosting such a great information session. The City of Richmond's Office of Aging and Disability Services has been deemed essential during the COVID-19 pandemic. Therefore, we've remained committed to supporting our most vulnerable residents, those who are 55 and older or 18 and older with physical and sensory disabilities. Research has shown that many of our older adults suffer from social isolation and loneliness during normal times, and during COVID, older adults have experienced a huge disconnect from family and friends, and thereby elevating these issues. It is our goal to ensure the needs of both populations are being met during this unprecedented time. In addition to the great work that Senior Connections is doing, we, through our Aging and Disabilities Helpline, are conducting care coordinations by phone, assisting those 65 plus in registering for the COVID-19 vaccination. And those who have contacted our office have been exhausted in their efforts in seeking the COVID-19 vaccination. And many do not have computer access or have given up on long wait times. Therefore, we've just been assisting them in getting registered, as well as providing transportation to their initial and second appointments. Also, during this time, we've been assembling engagement kits to keep people involved and engaged. Just last weekend on Sunday, we worked with Councilwoman Dr. Cynthia Newbill in assembling 600 bags to be distributed to support her for the Love of Seniors event. These engagement kits include such things as large print puzzles, journals to capture their thoughts, postcards, and stamps, watercolor sets, various fiction and nonfiction books and things like that, along with PPE, touchless door openers, COVID-19 information, mental health information, programs that are available to them, virtual programs, and a list of things that they can do. Some of the other services we are providing consist of financial assistance with mortgage, rent, and utilities, along with helping individuals apply for benefits such as SNAP, which are food stamps, and Medicaid, in-home services, real estate tax relief, which is due by March 31st. So I must add, on the onset of the pandemic, we received a huge request for food, but that has diminished greatly since then. And we, once again, we were supported in that effort by Senior Connections also. There are many older adults who live alone, and therefore we're providing well-check calls on those who are socially isolated. So if you know of someone that could benefit from this in the Richmond area, please contact our Aging and Disabilities Helpline, which the number is being presented on screen. And to assist those with mobility issues, we're providing access to adaptive equipment and gently used power and manual wheelchairs, rollators, walkers. So, which has been a huge help to support our families in the city. To combat loneliness and isolation among older adults and disabilities, we've created over 50 virtual programs since March. Understanding many older adults do not have access, once again, to computers, we've encouraged this population to participate by phone. However, I'm happy to say our numbers are increasing regarding the virtual number of regarding those who are able to participate virtually. Some of our upcoming programs consist of, a 4-week healthy lifestyles cooking class, a spring flower and garden session. Let's de-stress from COVID-19, which is something we all can benefit from. Benefits of acupuncture, fiction-focused book clubs, nutrition classes, and on. And we also have done some work with the Office of the Attorney General to share information about scams that are affecting and victimizing our older adults during this period that we're in. So along with the Social Security Administration, they've had some major changes. So we're trying to make sure that people are informed and have the right information. We do plan to do some virtual museum tours in May, and so that is just something that we're looking forward to. In partnership with the Greater Richmond Bar Association, we're doing some estate planning events and, consisting of, these are all free events with simple wills, power of attorney, and advanced medical directives. All of these things are being done virtually with attorneys, and they are able to get those notarized through our office. And lastly, the city has an Aging and Disabilities Advisory Board, which is this board meeting provides a great platform for older adults and individuals with disabilities to advocate for themselves and sharing how we can make Richmond a more livable city. And we encourage anyone who's interested to attend to join us every first Thursday for this virtual meeting at 10 a.m. So all of these programs have been designed for older adults and individuals with disabilities. If anyone's interested in participating, please contact us at our Aging and Disabilities Helpline that is being shared with you today. Thank you so much.
Thank you, Yvette. And thank you to all your staff and community partners who have done so much to help during this difficult time and are there in good times and bad times. We're at the point where we have about 15 minutes for questions and answers. It looks like the first question goes to Dr. Veray, and I'm going to try to combine a few questions, and I acknowledge that you may have answered some of this already, but if you're in the queue, so let's say you went into the queue, the local system, you're now included in the statewide system. So if you went to the statewide system or the local system, you're now in one system. It's called Vaccinate Virginia. And the questions are, how will you be notified? Where will you be asked to go to get your vaccine when it's your time? How much time do you think you'll wait if you're 64, so under 65? And can you find out where you are in the wait list, what your positioning is? So how are you notified? Where will you actually go? How do you find out your positioning, and how long do you think it'll be for those of us who are under 65?
we're gonna do that one at a time because I've already forgotten the first one. How will you be notified? How will you be notified is if you've only provided one or the other, we'll take the one that we have. We are aware that some of our individuals only have phone. They don't do internet. They don't have internet access, in which case we are calling them. Others, we may, it varies depending on the modality, because in some cases we have been, I would say there has been a variance depending on which of our partners, whether or not we're doing it and whether or not, we were able to reach out by email, or whether or not our partner's doing it and they wish to use a phone, they wish to use their phone bank to reach out. So we are actively using both email and phone unless there's only one. If there's only a phone number, which does happen for a fair number of our seniors, we will call. We do ask that if you get that phone call, that you not ask to call back later. Take the phone call, take the time and make the appointment there, because it's critically important that you're not saying, oh, I can't right now, I'm in the middle of something. No, take the phone call, do it, get your appointment, make it happen. Where does it happen also varies. We have a number of different sites, and we're actually expanding sites. So whether or not it's at something like Arthur Ashe, Richmond Raceway, we're also doing it a couple of in community churches. We're doing it through VCU at the Health Hub. We're also partnering we're partnering with a couple of like Bremo Pharmacy and Henrico. So it will vary. It will almost certainly vary. In some instances, like for example, there are independent living communities where we know there are a large number of mobility constrained individuals. We try to go out to them, but we have limited ability to do that. So we try to do that when we know that there's a large community of individuals, for seniors in particular, who will have either limited phone, internet, and or mobility access. And we partner with, we've partnered with RHA and a couple of other folks to try and identify those communities. Third, can I figure out when I'm on the list, where I am on the list? Because you can check on the state website if you're on the list. And I will say, as they're rolling this out, since this launched on Tuesday, that I would say, if you've entered your name and you check the list and you're not on it, give it a couple of days and check back again, because there are a couple of glitches they're fixing in terms of not being cap sensitive, there's a couple of glitches if you were on the list before, you are on the list, don't worry about, and if you can't find your name on the list, check back again in a couple of days before re-registering, because they are taking care of a couple of back-end glitches. How long will it take? As I mentioned, because there's a vaccine supply issue, we're not getting the things nearly as quickly as we would want, or as we're able to, in terms of our capacity to get vaccine in arms is more than the vaccine that we have. And so it's going to take several weeks just to get, it's taking weeks to months to get through our pile of our lists of lists. I think we're looking at I forget the number already. It's tens of thousands of individuals who are 65 plus. I'm not saying that we have to vaccinate every individual in that group before we move to 16 to 64, but we want to make sure we have made the opportunity available to a large number, and gone through a large number of them before we open it up to 16 to 64. And I would say I'm looking at March for that, by the way. If there was a fourth? Did I get the fourth?
I think you've got it all. Your position.
Oh, there was one thing I was going to say is, can I check where I am on the list? Because we are doing things because we're looking at age and race beyond timestamp, you can't necessarily say, and because we're pulling for different events at the same time, I can't say where you are on it. For example, we may have a list for a seniors only event. We may have a list for a mobile event that we're doing. So it's not, we may be pulling from the list to do that same list to do different events. So I'm not sure that you can say where you are on a list, period, because we're doing so many different things with the list. But you can check that you're on the list. That was one thing.
Okay,
What's the next question?
that makes sense. So the next question is, how does the CVS program work? I know CVS was doing it with Walgreens to long-term care facilities.
Right.
Let's keep that out of the conversation.
Very
Now
separate.
CVS is doing it to the public. How does that work? Is it a separate program from the state? Is it coordinated differently?
So we are hoping to see its coordination improve. It is a federal partnership, again, separate from what was happening with the long-term care facilities. It is one of several that are in the pipeline in a federal partnership to vaccinate. We have asked and we have tried to work with them to align them with our lists, but there were technological limitations on what CVS was able to do. So right now they are separate from our list. We are working with them to be able to align them with our list, but right now they're separate. So it is an additional pathway. One of the reasons that, and they get maybe 26,000 vaccines a week. So maybe that's 100 a day for 36 CVS around the country. What I have seen is that by the time individuals get to the list, get to that site, it's generally already filled for that week's lists, but they do have a site on their, they do have registration on their website. We are going forward looking at how we can align them with our lists because we have plenty of people on our list. And so that people aren't just hitting the refresh button, or actually I've heard that people are actually devising code for their parents to robo check and robo insert on the websites. So we are working with CVS to try to prevent that, but we're not there yet. So right now it is a separate entity, but as long as they're putting vaccines in 65 plus arms, it is overall a good thing.
Okay, thank you. Here's another question for you. When it comes to the second dose, there's a number of recommended days depending which vaccine you get. Can you get it sooner? Can you get it later? And if so, how and why?
Right. I would not, it is not recommended that you get it sooner. So it is not studied, and it is not recommended that you get it earlier than 21 or 28 days. It is best if you are able to stay within 4 days of that day. So if you can do it on days, 21, 22, 23, 24, basically if you can, those are like probably the best. That's what was studied in the clinical trials. That's probably your best bet. There is some, CDC has come out with the acknowledgement that if for whatever reason you can't get in there and it ends up being delayed, you can get that second dose up to 6 weeks after. However, I would encourage, and because of the vaccine limitations, we understand that scheduling might be an issue. It is best, and we are really trying to make sure that we're getting folks in there pretty close to that 21 or 28 day margin. So I would not get it before then.
Okay. Before, not so much. After,
A little space.
a little space. It makes sense because your immune system's waiting for a booster, right? So that booster can come.
And we don't know. And I think the biggest thing is we don't know if 14 days is okay. We really don't. And so it's not a good idea because I can't say there, if you get it by accident at 14 days, you won't get a third under current recommendations, but we won't know, we won't have the same certainty that we would if you got it at 21 days or 28 days, depending on your vaccine, that you're going to hit that 94 to 95%, or that you can anticipate the 94 to 95% efficacy if you got it that much sooner.
Thank you. I'm reading through questions, trying to figure out what's the next best one to ask you. There is some confusion about registering online or pre-registering. It makes it sound like when the first system was in place, perhaps they didn't ask age, but I certainly know now that the new system is in place, your date of birth is being asked. People are wondering, how do they know I'm over or under 65? So how do they know if I'm in 1B or 1C? But I mean, we do ask age, right?
We ask age.
Okay.
Earlier, there was multiple iterations. Our system locally asked age. We didn't ask for date of birth. We asked for your age. We ask you to self-report your age. And the new system does ask for age or date of, I forget if it's both age and date of
Yes,
birth. It
it's
might
date of
actually be.
birth. I was on it yesterday, and I signed myself up, and it was clearly date of birth. So, that's how they know your age.
And that's how whether or not you're self-reported or date of birth, that's how we're going to use it. It will, I am very much hoping that we are not sitting here next year that we have to worry about you being a year older. And I don't think we will be. I think we'll be in much better, we'll be over this hump by the summer. So I'm not as worried about whether or not you are 64 now and you're going to be 65 next year. Since I'm not anticipating still being there in a year.
Okay. So I'm afraid this answer is not the answer this woman wants, but she says, I'm 64 in 9 months. Does that mean I have to wait longer?
Oh, I see what you're saying.
5-year-old.
I see 64 in 9 months. I would say because by the time that May rolls around, I am hoping to have more vaccine available such that you will, if you are, also the other part is that right now on vaccinate.virginia.gov, you do not have the ability to update your record. That is coming. So when your birthday rolls around, if for whatever reason you have not been vaccinated, there will be the ability at that time. I'm just saying right now it's not there. So don't anticipate it right now. It's not there right now. They're building it right now to be able to adjust when your birthday does roll around. By that time, there should be the ability. We're anticipating that ability to fix it well before your birthday rolls around in 3 months.
Okay. There's a question from someone who wants to travel to Peru June 1st, and she's saying, when will we know if it's safe to travel? Where can one find out information about other countries?
Travel.cdc.gov.
Say that one more time slowly.
So there's 2 places. Travel.cdc.gov, not just for COVID-19, but in general is a good place for you to go if you're planning on traveling abroad. It will tell you both where they'll talk about COVID, but they'll also talk about the plethora of other things you need to think about and vaccines you may want to obtain before you go abroad. Also on CDC's COVID-19 site, they also have a travel specific area, but travel.cdc.gov will also cover things that are not COVID that you might want to think about. I would say in June, I don't know.
That's a good answer.
I don't. I thought about it. I don't think I can say. I don't think I'm going to be able to make a comment on that right now.
Well, I did not introduce you as an MD, MPH, a Master's in Public Health at the start of this program, but it has sure become apparent that you are.
I don't have an MPH, but I am an ID doc, so maybe that's where that part came from.
Yeah, you have that extra knowledge that's really been appreciated. We're getting to the top of the hour. I think we'll just do the one more question. It's someone who asked if I have severe reactions to shots, allergenic reactions, is there any alternative for me?
So right now, 2 things I would say for you, if you've had a lot of, especially if it's not just one kind of medication, but you've had it like whether it's an antibiotic or a heart drug or whatever, a lot of different kinds of medications, talk to your allergist, talk to your doctor about it. What might and whether or not they feel that your allergies fit into a category of, oh, they all fit into this kind of antibiotic category. So it's not a problem with polysorbate, or it's likely to be this category of antibiotic that you just had all different kinds of them. Or it might be one where they say, let's wait for the next vaccine category to come out. Johnson & Johnson is a different category of vaccine. It's a different type of vaccine. I don't know yet because we haven't seen the briefing stuff from FDA. What all is in the Johnson & Johnson in the same way that we do the Moderna and the Pfizer. but talk to your doctor about whether or not you might need to wait.
Thank you.
Yeah, someone who's had multiple different injection types and had allergies to different kinds of medications, I really need them to talk to their physician about, do you think this was all a drug class thing? Or do you think there's something, an additive that I'm allergic to that I need to be worried about? In which case you might need to wait.
Right. Okay, well, I am so grateful to you for the information that you have given us today, from the development of the vaccine to the immune response to side effects to how you can get it, where you can get it, how the system works. We are grateful for you. We're grateful for Angie Phelan and for Yvette Brown for their information. We thank our participants for staying with us and for the great questions that you asked. On behalf of AARP, I want to say again, thank you to our guests and to all that participated. I think we should put up a slide that gives you where you can find more vaccine information and the hotline number to the state system, as well as the website. There you go. And you will get a follow-up email with this information. So thank you all for your time. I'm David DiBiase, and have a great day and stay safe in this ice storm that we're having.
Thanks so much.